In our morning rounds, there is new thinking on psychiatry. Nearly 1 in 5 American adults lives with mental illness. It's an area of medicine that used to be overlooked, but that is changing. Dr. Jeffrey Lieberman is the author of a new book. It's called Shrinks, The Untold Story of Psychiatry. He is chairman of psychiatry at Columbia University and joins us at the table. Good to see you, Dr. Lieberman.
Thanks, Gail.
You said that there is still a stigma associated with mental illness, and that's something you think we need to change and rethink.
Absolutely. I mean, it's been historically the fact, and even though we've made tremendous scientific progress in the last 50 years, the old attitudes still prevail, and that was a major motivation for writing this book. The fact of the matter is that after 30 years of researching mental illness, treating patients, I became so upset that millions of people continue to suffer from the symptoms of mental illness because either they're ashamed and embarrassed to reach out for treatment or they don't know how to find it. It's like we have a population of people who are suffering from infectious diseases, tuberculosis, pneumonia, strep, AIDS, and we're not using antibiotics, we're not using vaccines, we're not using protease inhibitors. And it's due to basically lack of awareness and prejudice.
But it can be treated and treated effectively.
It absolutely can. I mean, in all candor, though, it's a recent development. You know, up until the 1950s, if you had a mental disorder, there was little that any doctor could do to alleviate your symptoms. But that's all changed. We do have effective treatments, whether it's medication, whether it's psychotherapy, whether it's neuromodulation.
But is there concern or too much concern in your estimation about over-treatment? 248 million prescriptions a year for antidepressants?
No question about it. I mean, antidepressants, psychostimulants for so-called ADHD, medication to treat childhood behavioral disturbances, but do we overprescribe antibiotics? Probably. Do we overprescribe some things? Yes. So this isn't a problem with the science, it's a problem with the clinical practices, which we have to contain. Better diagnosis, more rigorous application of therapies.
So there can be more diagnosis but less prescription?
Or less diagnosis. I mean, the population frequency of a given disorder is something which can be determined very precisely. And so people who have the disorder, who have symptoms that are distressing and disabling and want treatment should be treated. Those that don't or don't have the disorder shouldn't be.
How do you make that determination?
Yeah.
It's made the same way your doctor determines whether you need a cardiac stint, whether you need to take an antihypertensive. It's made by a comprehensive diagnostic evaluation, a discussion of patient, what the diagnosis is and what the treatment options are, and then selecting a treatment. The difference, which I think you're getting at, Charlie, is that in psychiatry, diagnosis is a little different. When you need a stint, you get an arteriogram, you get an EKG, you have your blood pressure checked. In psychiatry, we don't have that yet. It's all clinical. And that's going to change, but it hasn't changed yet.
But how are you going to get people to talk about it freely? I can talk about a bronchial cough, but who's going to say, you know, I'm having trouble coping, I'm having panic attacks, I'm just freaking out. How are people going to get to the point where they can say that comfortably and not feel judged?
Well, that's the dilemma. I mean, you know, people say it to their family members and their friends all the time, but they don't equate that with the disorder that may need to be professionally helped, and how do they get to that person? But if I could say one more thing related to it. The aversion that our society has had towards mental illness and the stigma that's perpetuated is symbolized in the military's attitude and what's happening with PTSD and suicide and the psychological wounds of war. These have been historically denied. They're now hugely prevalent. We should be all over this, just like we should be all over the treatment of mental illness.
Dr. Jeffrey Lieberman, thank you very much. Shrinks goes on sale tomorrow.